Breaking news from Eli Lilly's investors call on Tirzepatide, Retatrudide, oral GLP-1 medications. I got you all covered, friends. Hi, I'm Elizabeth, Countess of Shopping. If we have just met, I'm Elizabeth. I've lost over 98 pounds in the last, gosh, how many months has it been? 22 months. Here's my before and after. I just got back off of an airplane. This happens every single Eli Lilly investor call. Last investor call, same thing happened. So I'm racing from a red eye to get you this information. So I love you guys so super much and have foregone my sleep to get you this important information. The first thing that is up, and I will cite as always, being accurate is important to me. I'm not anything medical, so make sure you always talk to your own healthcare provider. Hopefully my videos will spark you to have those conversations with your healthcare provider. We're going to talk about my favorite healthcare provider here in a little bit. But many great things came out, and here's the first slide. And again, I will link these down below if you want to go ahead and read them. But basically, the Tirzepatide 176-week SURMOUNT-1 phase 3 study, which, friends, that is over 3 years. That's amazing. It was the study of Tirzepatide in adults with prediabetes and obesity or being overweight. So you had to have prediabetes and obesity or prediabetes and being overweight. They found the risk reduction was reduced of risk reduction of progression of type 2 diabetes compared to a placebo over a 176-week treatment period was decreased by 94%. So this is when people tell me like, oh, I'm gonna get off my Tirzepatide medication. I'm like, let's rewind it because of this reduction for type 2 diabetes. And I don't know about you, but for me, being morbidly obese before starting Tirzepatide, I've been on Zepbound, Mounjaro, and then Tirzepatide compound, now back onto brand name Zepbound. Being morbidly obese, like type 2 diabetes, my blood panels, like that is the forefront of it, of course. And if you don't have type 2 diabetes, that knowing that there's that reduction risk of the progression of type 2 diabetes by 94%. And we have over a 3-year, it's the 176-week SURMOUNT-1 phase 3 study. So that is fascinating information. In addition, this is great news, is the average decrease in body weight was 22.9%. Average decrease in body weight with 15 milligram dose. So that's the highest dose for Tirzepatide, which is Mounjaro or Zepbound, same thing, 2 different FDA approvals. We're going to talk about FDA approvals here in a minute. The average decrease in body weight with the 15 milligram dose at the end of the treatment. So that's where, and if you start to do the math of where you are from where you started with the 22.9%, you may be pleasantly surprised and be like, oh, I'm higher than the average or whatever. Like, to me, that was fascinating about that information. Overall safety and tolerability were consistent with the previously published results of SURMOUNT-1 and other Tirzepatide clinical studies conducted for weight reductions and long-term maintenance. Let's kick it over to talk about Retatrudide. Y'all know I foam at the mouth. If you haven't seen my previous 2 videos on Retatrudide, that is, do I have it in here? The Godzilla of GLP-1 medications. It is the big one. Where's my little dinosaur? I have my, oh, here's my little dinosaur. So this is what Retatrudide represents for GLP-1 medications. And this is like semaglutide. Like, whoa. And then Tirzepatide is like in between. This one is, whoo, I am excited for somebody who is on the highest dose of Zepbound. I have nowhere else to go. Having a higher performing GLP-1 medication is really, really pumped. Now, I pulled these slides and there's something whack going on with my lighting. Y'all, I just got off of a red eye. Please have grace with me. I cannot fix an altar that's really bright here in Virginia today, so forgive me. It's gonna be bright, but I'm gonna put those slides. I was gonna show you guys the whole slides. I will put them down in the description link below. You can go ahead and click on that link down below about Retatrudide. And if you are looking, if you are on, we talked about the compound, we're gonna discuss that too. I've got some solutions for you with that as well. I found that that was fascinating. But let me click over to the Retatrudide part here and then the Tirzepatide. Going back over to, okay, Retatrudide. The study of Retatrudide in participants with obesity and cardiovascular disease. Wow, that is really bright. You guys can brighten me up. There was in phase 3, there's 1,800 participants and percentage change in baseline and body weight. So the primary completion will be January 2026 with completion February 2026. So we hope that gives a good timeline of like, okay, when is that done? And then we have the FDA approval off of that, which takes a hot second. Like, their regulatory red tape, wisely and unwisely, takes some time. But so that completion for Retatrudide for people with obesity and cardiovascular disease, February 2026. And they sequentially go down, like that's the earliest of the completions of Retatrudide. The next one, which I am so excited about this, we know semaglutide has one hormone, it's a GLP-1, Zepbound, and that is, semaglutide is Mounjaro and Wegovy. Zepbound and Mounjaro are Tirzepatide. They have two, GLP-1 and GIP-1. Retatrudide, it has more than that. And so the study of Retatrudide with once weekly in participants who have obesity or are overweight and osteoarthritis of the knee, it's called TRIUMPH-4. That one is in phase 3. It has over 400 patients. And so they're monitoring the percentage change in baseline and body weight and change in baseline in the Western Ontario and McMaster Universities of Arthritis Index. And so that should be done like total completion March 2026. So you can see like we're in 2026, that's not even FDA approval. Like that's just being done with these studies. The next Retatrudide one is people who have obesity and overweight. That's the one I'm excited about. And of course, type 2 diabetes ones too. But TRIUMPH-1, that has 2,100 participants. And they're looking to see, okay, what is the percentage change in baseline and body weight? That one will be done May 2026, if all goes according to plan. Then the next one is on obesity. And so all these indications are for obesity. So if you have chronic obesity management, which is a disease, can we say it louder for the people in the back? It is a disease. It's not a moral feeling or a lack of willpower or any of that other garbage. It's a disease. The study of Retatrudide in participants with, this is the one I was telling you about, type 2 diabetes, with oh my goodness, I'm gonna butcher it, mellitus who have obesity or overweight. There's 1,000 people in that. Percentage change in body weight. That one again, May 2026. And then the effect of Retatrudide once weekly on cardiovascular outcomes and renal functions in adults living with obesity. 10,000 people, 10,000 patients. So it's from the time of the first occurrence of the endpoint composite endpoints of non-fatal. So it's going on and talking about that. The endpoint of that is February 2029, but there's 10,000 people in that one. Okay, the next slide that they had, so one of the things that Eli Lilly said was their money. Let's talk a little bit about money, honey, and I'm gonna come back to these too, is that revenue grew because of Mounjaro and Zepbound by 42%, and they're expecting it to grow by 50% in Q4. And that was because of Zepbound and Mounjaro. In addition, the compound safety component, that's they kept talking about like how the FDA lawsuits, which go see my other videos, make sure you click like and subscribe for this video. But if you see my previous videos on compound for Tirzepatide compound news about how these lawsuits going back and forth with the compound pharmacies suing the FDA, and Eli Lilly was talking about heavily the compound safety component of people are being harmed. And in some of these ones that Eli Lilly is suing, like my husband and I had this conversation. He's like, can you imagine some of the people are mixing stuff? I'm like, are you kidding me? I can't even make a Betty Crocker cake recipe of mixing things properly, let alone something I'd be injecting in my body. Like I can see why they're saying people are going to be harmed by these things with no FDA oversight that they're having and like with that. And so it was interesting hearing them talk about that. But there was $3 billion in growth because of Zepbound and Mounjaro. They also said expect the more regulatory things coming out with Tirzepatide, which we know, I've covered that. I would encourage you, if that is you and you're on Tirzepatide compound, two things. One, if you have not thought about making the switch over to semaglutide compound, that is not going away anytime soon, although Novo Nordisk has started the legal process, but that is going to take a while if that does happen. You can join Eli Lilly's, excuse me, that's not that at all. You can join Fridays. Use the discount code QUEEN. That is who I use for my telehealth. That is the one that I recommend. That is who I've vetted. I've used them since 2023 with my own health. Use the discount code QUEEN. You can do video consults, or you can do once you've been on a prescription, or you can submit. You have to have there's certain qualifications to have that, of where I can just submit in the portal. There's twice weekly dietitian calls. Like that alone is amazing. And you can also get brand names. So you can do compound with semaglutide, or you can do brand names like Zepbound or WEGOVY for chronic obesity management, pending you qualify, of course. Like, it's a reputable medical place, so they're gonna have you do blood work. Don't scoff at that. That's a great thing. Like, when we were like, I don't want to do blood work, I'm like, then you shouldn't be on a prescription. Like, we need to have that medical oversight. Like, it is a medical prescription. And I appreciate they have a ton of medical protocol, which I appreciate. That's above my pay grade. But I would encourage you, use the discount code QUEEN if you're thinking about switching. The other big part about that, if you are on brand name and you're having issues, and Eli Lilly talked about this in their investors call, about having more people with employers having approval and insurance companies and things like that. Join Fridays has a whole PA, prior authorization department. It is large. They invest a lot of their money back into that to help people get approval with their insurance company to be able to get the medications. Because with PAs, prior authorization through insurance company, you got to jump through hoops. And I don't know about you, but submitting that paperwork is daunting. And so the fact that they do all of that and have a department for you, it's a concierge part of it for the PAs, for the prior authorization concierge department. I appreciate that. I'm like, y'all handle that for me. So also, it is open season right now for health insurance. That is rapidly closing. So check with your employer if you can change health insurance too. That may be helpful. And join Fridays, use the discount code QUEEN. I will link that down in the description link below. They're who I recommend, and who, I mean, they've been in charge of my health now since 2023. It's been a hot second. Okay. The other thing with Tirzepatide that they were going through talking about is looking for broad commercial formulary coverage in the US for Tirzepatide. As of October 1st, we have 87% access, which I found interesting. I don't have formulary coverage with my health insurance. I pay out of pocket like many of you do. In my free encouragement group, which I'll link down below, people are talking about how they're like, what can be side hustles to help pay for it when your insurance doesn't? I thought that was a fascinating thread in the free encouragement group. I'm like, that is a very good point. Like, some people's stuff was interesting to be able to afford their medication. I'm like, that is fascinating. I never thought about that. But the other parts that stood out to me, and we're going to go over to Tirzepatide. So we talked about Retatrudide. That's amazing. But for Tirzepatide, that there's $6.7 billion in research and development. Like, the fact that they're investing so much in Retatrudide, and then there's the other one, and I'm going to butcher the name of it, and you guys are going to get mad at me. Don't get mad at me. Or for Glypron. It's the oral GLP-1 medication. That we're going to talk about too. That is a fascinating one of where that stands too, because that oral pill, it's not an injection. I know so many of you don't like injections, so that's a great one. But Eli Lilly has invested, they said on the investors call, $6.7 billion in research and development and $3.6 billion in capital investments. So like these manufacturing facilities and things like that they're going to be building. And then $4.5 billion in business development. Which I was super curious the difference between research and development, but I was like, oh, that's where they're like actually testing in clinical trials versus the business development side of it. I was very curious. I'm like, well, what is the line item for business development? My business brain went there. I was like, that is fascinating. So that, just a ballpark figure, let me add that off the top of my head, 11. So like 14 billion on research and development, capital investments, business development, like future stuff, basically. I found, and that's when people get persnickety about the price, but the price is crazy. I mean, it's $1,000 a month for Zepbound and Mounjaro without the savings card or insurance. But there's, I think, a happy medium. You guys know, I think most of you know my opinion on that. There's a happy medium of where like capitalism, they're investing so much money here. 11, and I'm just ballpark, that's not exact, approximately $11 billion in future stuff of research and development, capital investments, and business development, future growth for medications. It's one of the reasons why the price is so high. I mean, I don't have $11 billion to upfront. If it all works out, you know what I mean? Because some of these things won't. Going on, it's talking about the ongoing process of expanding employer opt-ins. They launched the single dose of 2.5 milligrams and 5 milligram Zepbound vials for U.S. self-paid patients through Lilly Direct for less than half the list price of other endocrine medicines for obesity, significantly expanding the access and supply of Zepbound, saying that there is not a Zepbound shortage. They're also announced the positive 176-week top-line results, which I reviewed for SURMOUNT-1 study, where tirzepatide reduced the risk of developing type 2 diabetes by 94%, and expect submit for heart failure with tirzepatide heart failure before the end of this year. So they're going to be submitting that to the FDA. That's exciting. And then also increased supply for back orders too. And it was interesting, they were talking about pharmacies. Yeah, was it pharmacies? About how people are picking which medications to have in stock. That was interesting. Like just hearing the banter on that part, I'm like, I never really thought about that. But with their other big part of why the 50% increase for Q4 was because they're entering other markets. Eli Lilly did say, of course, not sacrificing the current patients that they have, but they're entering foreign markets. They're going to be launching in other foreign markets as well. The regulatory, the key events for 2024 is phase 3 initiations for retatrutide for type 2 diabetes, retatrutide for cardiovascular outcomes for chronic weight management, regulatory submissions for tirzepatide for obstructed sleep apnea and tirzepatide for chronic weight management, phase 3 data disclosures for tirzepatide for obstructive sleep apnea, which is SURMOUNT-OSA. And then they have a one for tirzepatide H2 study versus semaglutide. Woo! And then, did you know, okay, so Trulicity is another GLP-1 medication. And what kind is Trulicity? Let me ask Google here real fast. But their quarter 3 2024 results decreased by 22%. What type of GLP-1 medication is Trulicity? It's the dulaglutide. It's injectable, if you're wondering. So talking in there about how they decreased by 22%, which makes sense because if people are having good results with tirzepatide, that makes sense. Now, the other thing that I found fascinating too from the investors call, I listened to it, so you don't have to, was the percentage change in the clinical trial that they're doing that will complete, oh, wait a minute. Wait a minute. It's a study of tirzepatide in participants with obesity or overweight with weight-related comorbidities. It's the SURMOUNT-5. It had 700 patients. And they're testing the recent change in baseline body weight. Will be done in November 2024. It's literally in a couple of days, by the end of November 2024. Then also the next study to be done in May 2026 with tirzepatide is for maintenance of body weight reduction in participants who have obesity or overweight with weight-related comorbidities. 400 people are in patients, and patients' maintenance of the body weight reduction, it's a 60-week weight loss period. That's May 2026. And then once weekly, so it's adolescent participants who have obesity or overweight with weight-related comorbidities. They have 150 adolescents, or it's patients, but it's for adolescents. They're testing the baseline change in BMI, body mass index, and that will be done by October 2026. And then the study of tirzepatide with adolescents, is that not the same thing? So there's another adolescent one. It's SURMOUNT Adolescents 2. The other one was SURMOUNT Adolescents 5. The other one has 300 patients, so double the amount of patients. The other one had just 150 patients or adolescents. This one has 300 adolescents. That'll be done June 2027. So you see how the research and development and all of these things, like they're putting so much money into these testings and trials. The study of tirzepatide and the reduction in comorbidities of adults with obesity, 15,000, it's over 15,000 over 300. And it's time and first occurrence of any component event of a composite. All-cause death, non-fatal myocardial infection, non-fatal stroke, coronary vascularization. See y'all, I'm not medical there, I beg your pardon. And then heart failure. And that will end October 2027. So there's lots of cool stuff. There's more studies that are coming out too with tirzepatide, with type 2 diabetes, and those are ending in 2025 and 2026, and more adolescent ones. Now, the other one that I did say that I wanted to cover is the orforglipron, and y'all, please forgive my non-phonetic. I just got off a red eye. I am exhausted. I'm doing the best I can. Do you see these eyeballs? I was up, literally left LA. I was at LAX. leaving. If you guys saw me on the TikTok Brand Day Shop, I was one of the hosts. I was there for hours and hours and hours and hours. I was on and off for 8 hours. If you saw me, thank you for tuning in. I appreciate that. But that's why have some grace for me, please. I apologize. For the Or4 Glypron, it is the oral GLP-1 medication. And so there's a ton of those studies. And so that was someone's question too about, okay, with the oral medication, the oral GLP-1 medication coming up, it's not been approved obviously yet, it's still in clinical trials. Will that alleviate some of the Tirzepatide supply chain? And yeah, I mean, not having to have something refrigerated, like the refrigeration process of having Tirzepatide with Zepbound and Mounjaro, like is huge. And so not to just have a pill format is going to absolve a lot of operational challenges. And so I found this fascinating. It's the study of the oral pill, the oral GLP-1 medication in adults with participants with type 2 diabetes and inadequate glycemic control with diet and exercise, 520 participants. That one's going to end on April 2025. And so your ears perk up and you say, April 2025, that's 6 months from now. Woo! Okay, let's cool our jets a little bit, because then if the approvals of these things, it still has to go through the FDA approval. And they talked about that on the call, Eli Lilly did, about these lawsuits going on that FDA needs to have regulatory control over not having generic drugs, basically, with the compounds. And so I got very excited seeing this about April 2025 completion, but it still has to go through FDA approval and FDA regulation on that. So we're excited, whee! But we're also tempering that excitement because there's going to be some time after that too. But this pill, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. I'm not going to read all 11 studies in this particular video. And if you want me to do another video specifically on the oral GLP-1 medication, I'm happy to do a deep dive, and I'll do a little bit more research on it as well. This is fascinating to me because it would absolve a lot of supply chain issues. A lot of people don't like doing medications, the refrigeration component. But then what is the data? You guys, I go back to my little dinosaur analogies. I go back to my little dinosaurs. Where would it be in the pecking order in terms of effectiveness with GLP-1 medication? So all in all, good call. You know, I leave these calls because they're for investors of feeling like uplifted and excited and motivated. And I always do leave the investors calls like, yay! But knowing that that's part of the shtick of any investor call, not just Eli Lilly, but any investor call of like feeling positive and uplifted and like there's good news because there's good stuff in the pipeline. So that made me very excited. Let me go check my show notes real fast to make sure I'm not missing anything else. But those were the main things that I pulled out of it. I would love to see in your comments what you pulled out of it personally. If you watched or listened or whatever, if you're like, oh, I thought this was interesting, I would love to know down below. But those are my big ones for the investors call. I also, if you're looking to switch over your telehealth companies, join Fridays, use the discount code QUEEN. You can either do the compound route with semaglutide or brand name with Zepbound and WEGOVY. It has on there though that PA department that is huge. Not having to push that paperwork is a big, big deal. You can use the discount code QUEEN with that. I had previously shared about how, I don't know if I have a picture of it, bought I don't think I did, the vibration plate, because you guys told me to. You said, Elizabeth, go test some, because you guys know I love testing products and I'll give you my honest opinion. And I tested it and I actually really like it. Now these vibration plates, it makes me think, do you guys remember those like clippings back from like the 1800s where they had those belts for women to lose weight where they're like, it makes me think of those. Because it is but you stand on a platform. The one I bought, like, and recommend, because I'm tall and it's a larger board, and the price isn't crazy, I'll link it in the description. It's in my Zepbound Amazon shopping list. Click on that link to get to the description. Click the ... more button so you can see all. It's usually next to the hashtags here on YouTube, and you can see all of the links that I have. That one I really like. Now, I don't necessarily, so a lot of people have said it helps with lymphatic drain. I don't know. I don't have any scientific studies to back that, and I do like to have scientific references. If I'm sharing something with you, I'll either share my opinion, or if I'm saying it's like a scientific fact, to have a source to cite that. So other people have talked about lymphatic drainage. I have not done my due diligence yet to see if there's studies done on that. I'm curious if there is about the lymphatic drain from, but standing on it, literally the balancing of my core is sore after using it. I bought the one that has the bands that come with it, so it's helpful for weight training. And just the balancing on that has been actually amazing. I am pleasantly surprised. It's a purchase where I was like, to be honest, I was kind of like, and I've tested them before and I like them. And the brand that I bought, again, is one I've previously tested. And I know that they always have quality products because I've tested a lot of their products. But in terms of like making my abs and core stronger, I actually really do feel a difference. So if you're trying to work on strength training, it's cool to do weight training on this, and you can make it a lower vibration or higher vibration. Anyways, if you want me to do a more in-depth video on that, let me know, but I will link it down below. I was at the Go Pure, I was one of the hosts for the TikTok brand day deals for them. Their body cream that I've been talking about that I helped launch with them live comes out on Amazon on November 1st. So I'll link it down below here on my beauty shopping list. If you're watching this video on November 1st or after, we'll have it. In the interim, their Go Pure's tightening neck cream, I really do like it quite a bit, actually. I'm pleasantly surprised. Pleasantly surprised. It is a great product. I've used it for months and months and months, and it's nice. And the price point is nice. It was just one of the reasons why I like it. You guys have asked in conjunction for Crepe Erase or the other QRX one. QRX, do I have it in here? Oh, I do. Okay, so this one has in here from QRX in the jar, it has 2 ounces. This is 1.7 ounces, just to kind of give some, you can see the packaging, 2 ounces, 1.7 ounces. That's crazy, by the way, but that's the packaging of it. This one has lemon verbena scent. You can get unscented. I like I like both of them. It depends on your price point and what you're looking for. And then the Crepe Erase is super bougie expensive. However, it has, it's not in a jar. It has a different, and I don't think I have it in here. It's where you push it and the product comes up, so you're not putting your finger into the jar or a spatula or a Q-tip or whatever. So still love those for loose neck and then body products as well. Other people had asked, do I like the Go Pure versus my Crepe Erase and Sol de Janeiro? I do. I think it's a great product. I like the consistency, and I've tested a ton of these products. I really like the consistency of Go Pure's body. So again, if price point is an issue for you, and you didn't get Crepe Erase during the Prime Day deals that I was talking about, that may be an option for you coming out November 1st. So, sweet friends, I love you guys so super much. Make sure you check out all the links down below, all the free links down below, and hopefully this was helpful. Hopefully my lack of sleep was helpful for you. It's my whole reason why, and now I'm gonna go to bed. It's literally 11:15 here East Coast time, and I've been up on a red eye. So I love you guys. I saw Duke, I took him to school, and then I was like, I got it on air. And the count's like, do you want me to make you some coffee? And I'm like, oh, I'm so tired. I love you guys so super much, and I'm grateful I get to do all this because of GLP-1 medication. Be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. Our emoji of the day is going to be a pen or pencil, because I was taking a lot of notes on that call. And that tells me you made it this far in the video. I will pray over you. It's like our bat signal. If you don't believe in prayer, I'll uplift you in positive thoughts. Tell me your accountability question down below. What are you doing today to move you closer to your goals? Be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. Love y'all. See you tomorrow.